this episode, we connect with local healthcare heroes from DuPage Medical Group who are primary care practitioners, and they share their tips on how we can stay healthy and informed while sheltering in place. We'll meet Dr. Jason D., Doctor of Internal Medicine at DuPage Medical Group, along with Dr. Priti Amin, pediatrician at DuPage Medical Group, and they practice at the Naperville facility in Rolling Ridge. Dr. Jason D. is also my dad, and Dr. Priti Amin is a longtime trusted primary care practitioner and pediatrician for my sister and her younger children. So these are two voices that I trust and respect and who shine in terms of their care and consideration for the information they impart to their patients and the way that they truly care about people. In this episode, we discuss the current state of healthcare and how COVID-19 has modified their practice. They also share information on telemedicine and virtual appointments, as well as information about our immune system and how parents can best help their kids and teens deal with the stress during this time. I hope you guys enjoy this episode. Welcome to Tuesdays with Andrea. It's the inspiration station for everyday people guiding humanity forward. I'm your host, Andrea Rios McMillan, and every week I pursue conversations that matter with people who can relate to the common struggles we all face. You'll get to know the person behind the profession and find commonality with people of all ages, cultures, and backgrounds. Listen as friends, neighbors, and coworkers offer meaningful, personal explorations of modern life and the values we hold dear, all for the purpose of strengthening and uplifting others. Hello, everyone. Thank you for tuning in to Tuesdays with Andrea podcast. Today we have DuPage Medical Group local healthcare heroes, and I'm excited to bring them to the show. Thank you guys for joining. This is Dr. Jason D. and Dr. Priti Amin. Welcome, you guys. Thank you.
Thanks for having us.
Thank you. So the purpose of this show is to recognize your work as local healthcare heroes. You guys are out there helping us stay safe and healthy. And we want to also learn some tips from you guys about ways that we can contribute at home to keep ourselves safe, but also questions about if it's safe to go to the doctor right now, and from a medical perspective of being our primary care physicians and being the people that we trust with our families and our kids. There's a lot of questions, a lot of uncertainty about what's safe, what's not. And so I just wanted to bring you guys in to clear up some of and start that discussion. So thank you guys for being on the show. And why don't we start with you guys giving us some background on your professional background and what you guys do for your jobs at work.
Okay. I've been with DuPage Medical Group since 1998. I'm an internist, and I usually see adult patients. My partner Priti sees the kids, so 18 and above is mostly what I see.
I'm Dr. Priti Amin, and I've been with DuPage now for 20 years. I actually joined in 1999. Dr. D actually hired me. I see kids, newborns from age obviously 0 up to about 18 years of age. And once I start going to college, we transition over to the adult side of the medicine.
And me and Priti, we've been partners for a long time. So we have a great working relationship. She gets them to a certain height. And then after that height, if they get taller than her, then she sends them to me. So that's how it works.
I have to wait a little bit longer because I'm really short. So they have to get like a couple inches taller than me.
Then they transfer over. That's right.
And just so you guys know, so Dr. Jason D. is also my dad. And so thank you, Dad, for coming on the show. I appreciate it. This is new for him. He just started with telemedicine, and now this is his first podcast appearance. Thank you.
Thanks for having me.
And Dr. Priti Amin is also our family pediatrician. And so right now she's a pediatrician to my sister's young children. And these people are the ones that we trust and we go to for all of the medical expertise and advice. And it's different because most COVID conversations, most healthcare conversations right now that I'm seeing focus on the hospital front, and rightly so, because that's where the immediate and intensive care action is. But then from the regular everyday practitioner lens, you guys have a different perspective and you're seeing something different every day. So I'm interested to understand, how has this changed your work, and what has this been like for each of you?
Well, the first thing was that, like everybody else, I mean, there was a great concern that, who's got it and how infectious is it and how much of a risk to bring my patients here or seeing them. So DuPage Medical Group has been very good about separating our clinics. And so we knew we had to address the COVID situation because that particular crisis kind of sucked all the air out of the room. I mean, because that's the dominating problem we have here, right? But people still have diabetes, people still have heart disease, people still have COPD and asthma, people still need to be seen. So how do you take care of those without exposing them needlessly to undue risk? So we did several things. One, we separated the sites so that some sites are well sites like ours, so that you can come in there, and some sites are sick sites, specifically made for folks who have COVID symptoms. We also screen our patients on the phone, so they're calling up. So if they don't know they have COVID or not, because it has a myriad number of symptoms. It's not just the respiratory symptoms. It could be other rash or diarrhea, things like that. So we screen them on the phone. And if it sounds like they might have COVID symptoms, then we send them to one of our COVID sites first and have them evaluated there. They're seen there. They stay there for the next 28 days until they're clear. Even if they pass through that screening and they come to our office, we do check all our staff and all of the patients coming in. There's a nurse standing in full protective gear with a thermometer. Hopefully she doesn't scare you, but she's really there for your own protection. We check all of the employees and us coming in on our temperatures. All the patients coming in, we check them and we give them a little questionnaire, see if they're okay. And if there's a problem, then we'll redirect them.
You're describing the new process for visitors for
our clinic, yes.
DuPage Medical Group has been very up in front about medicine. You know, we've actually been offering televisits since 2014, and it has not been something that really has gained much attention. But of course, in this scenario and in this situation now, it's really come to the forefront. They've really matched it out where almost 95% of our primary care providers have the ability to do televisits and video visits now, which is there to reach out to those patients that don't feel comfortable coming in or on their individual risk factors. This is a changing field or a changing time. You know, every couple of weeks we learn something new and different. And we have it's a multi-layer protection because when you call to make that appointment, you will get screened to see what's an appropriate place for you to go. After that, you know, once that appointment comes, when you come to any of our facilities, before you come in, there's also a secondary process, as Jason was explaining there. Mm-hmm. And during this time, it's important to keep those primary care appointments or well visits, especially speaking from a pediatric perspective. One of the most common questions I've been getting asked is, should I bring my 2-month-old in? Should I bring my 4-month-old in for their routine vaccinations? And again, Illinois Department of Public Health, the CDC, the AAP, they all are recommending keeping up with our routine vaccinations because during this time of COVID, it's important that we prevent the illnesses that we can. And these are vaccines that we are giving that are life-saving for children and to avoid complications. And again, we're taking all these precautions for the safety of not only of our providers, our staff, but also our patients as well. When you do come in now, everybody is masked. So now somebody's going to ask, how are you going to mask a 2-month-old? Obviously, we're not going to mask the 2-month-old. But for kids younger than 2 or kids that are in carriers, we recommend that you keep that blanket over them or, you know, something that just a light covering over them. Mm-hmm. For kids 2 and above, we're masking everybody. Now we realize that a 3-year-old, right? I mean, if any of us have children, it's a 50-50 gambit on that 3-year-old trying to keep that mask on. So we're doing our best in that situation. I think that's part of this is you need to have that fluidness. Our special needs patients that cannot tolerate a mask, again, that's another population we need to be understanding. That's why the rest of us who can wear a mask need to wear a mask. We also limit the number of foot traffic that we have in our offices. I'm not sure about the adult end, but in the pediatric end, you get 1 support person. So both parents, like the whole family is no longer coming in. And that's something we miss, but it's something we need to know. I don't know, Jason, what are they doing that on the adult side?
For the adult side, it's just the patient themselves. But if they need a translator or if it's someone who maybe they're not real good historians and they need a family member to help come along to help either with translation or just to help clarify their history a little bit, I will have them bring 1 support person with them too. Because sometimes you do need that to get the whole story.
There's this fear right now of people going to the doctor and really wanting to be exposed because what we think from our, at home lens as regular civilians in out here is that's where the sick people go, is to the doctor and to the hospital. And that's the last place I want to go. But what's the risk of us going to a medical group versus going to the hospital? And then to that point, if we go to the medical group, what are those things that we should be going for? And what can we stay at home and use the telemedicine and virtual appointments for?
For my end, going to see us at a clean site is definitely lower risk than going to the emergency room or the hospital, because it's, even though they try to partition and use full protective gear, and I know they're doing all that, it's still very difficult to, if it's, that there's COVID patients coming through, that to completely separate that. So ours is most likely safer. Before all this, I'd done exactly 0 video visits, right? And now it's, I'll do like 5 or 6 a day in the office there. So it's almost a third of my patients. Now, as the numbers of the COVID have peaked, the word has gotten out that we're a clean site, I think I'm seeing more in-person visits. In the end, I would really much rather see you in person. When I'm looking at you through a screen and you're trying to show me a rash or you're trying to show me the back of your throat, it really doesn't show up that well. And also, depending on your internet connection, I sometimes don't get all of what you're trying to say to me. So I would rather see you in person. However, I do know that, there's patients of mine who are going through chemotherapy. There's patients of mine who have bad asthma or COPD, and maybe I wouldn't want to increase the risk there. So there is a home kit that I ask people to have so that we can do some of our visits. I can't replace all the visits, but some of the visits to there. Having a home blood pressure cuff, having a home thermometer, having a glucometer if you're diabetic are helpful things so that we can talk about it on a video visit. And then what I can do is have you bring your blood pressure cuff on your next visit just to calibrate it with mine to make sure it's accurate, and so that then we get rid of the white coat hypertension syndrome as well.
But is that something that most people have with them, right?
A lot of folks do have a thermometer.
Well, a thermometer, but what about the blood pressure cuff and that other device that you mentioned? Is that something that's common? Can we buy it off of Amazon?
Yes, you can. Yeah. Mm-hmm. The one that I use in my office, actually, I bought it from Amazon. It's an Omron, and it's been used in a lot of studies as well, too. And they make, whether you buy a CVS or Walgreens branded one, they're made by Omron or Sunbeam, and they just put another brand on them usually. But that's a good one. It usually costs about $60 to get a decent home blood pressure cuff. And most of my patients that have high blood pressure medicines or cholesterol meds or heart disease, they have a home blood pressure cuff. I already asked them to get one. Most of my patients, I hope all of my patients who are diabetics have a glucometer. So they would have those things already.
So for pediatrics, we're thermometer lovers. We definitely would like for you to have a thermometer at home. A scale is nice for some of our older kids, so at least we can get weights and see what's going on with them. I think for our well visits in pediatrics, it's a little bit different than adults. We need to see the kids because they're changing. Unfortunately, we cannot hear their heartbeat over telemedicine, no matter how good we get with it. But visits, if people don't feel comfortable coming in, rashes. So again, as Jason said, everything is easier in person. Obviously, there's that little connection. We get to see people. A lot of teens if you're struggling with anxiety or depression, that may be a good telemedicine visit. Behavior issues we can do over telemedicine. We're actually doing some sick visits. Like, for example, I recently had a child who had a superficial burn. That was something we could see. Diaper rashes are very common over the telemedicine. I think anything that can give us a sense more for the ill visits or when they're not feeling well, is this something that acutely needs to come in and be seen by somebody? Or can we do some trial things at home and then see how that develops? And I think each case has to be taken individually. As Jason said, if you are living in a home with people that have high risk, because most kids are not high risk. In general, we've been fortunate that this illness has not truly affected kids. There are certain high-risk populations of children, obviously, but overall, this is to be more for the elderly and the immune compromised or comorbidities. So if you have a child who's living in a home with somebody who has multiple risk factors and they have a diaper rash, that might be a good telemedicine visit, to initially start. And if that's not improving, then that's something that we'll need to see you then.
And for telemedicine visits, is there anything that we need to know before we have that visit with you guys? Do we have to have our basic vitals already ready to go? Or are we just really just having a conversation? These are the symptoms I'm experiencing. And if we're able to show you visually through the computer, great. Is that what it's for? Is really to have that upfront communication piece?
It is. And I think some basic things that would be handy is if you've taken your temperature. Mm-hmm. That's always handy to know. Whatever medicines you're using, maybe have those easily available, because I found that's been helpful when somebody tells me I'm using this over-the-counter cold medicine. I would love to tell you that I know the ingredients in every single one, but if anybody's walked down that cold medicine shelf, it's a little overwhelming, even when you're a physician.
And if you're taking any supplements.
Yeah. So I think having what you use and take with you to have that handy is helpful. If it is a rash that's been going on for a couple of days or something, if you've gotten pictures from before, you can upload those on so we can see those to document it. And if you think about it like you're telling a story, so if you have a few minutes to think about like how long has this been going on, how much is it affecting you, when is it worse, those kind of questions.
Like who, what, when, where, why.
Yes.
The 5 W's.
5 W's. If it is an ill visit, we are going to ask you about COVID exposure, clearly, especially at this time. So we're going to have you think about, is there anybody that you could have had exposure with? What is your routine? Have you been going to the stores? Have you been wearing your face masks? And these are not judgmental questions. These are questions for us to gain information. Everybody's situation is different. Everybody, and I think that's what we're, in all of this, we have a lot of general rules, but we have to look at each individual for that individual and that family. But those are the questions that we're asking.
And you mentioned COVID-19. Let's talk about that and get into like, how likely are we to get COVID-19 now? And what's the state of the spread in our area? Is it increasing? Is it going down? Is the stay at home working? Have you noticed decrease in symptoms from patients who are going to you?
As far as your risk, because COVID-19, a lot of folks have mild to no symptoms, I couldn't tell you how likely you are walking down the street to get it then, right? So the only thing I could speak to is the social distancing, is the stay at home, is the other stuff working? Yes, because you can see that the numbers are plateauing, and hopefully we'll see a decrease soon, and then they can start to open things up. And I would love to have people just be able to go out and do stuff again, and even if we do within, hopefully there'll still be some guidelines wearing face masks and social distancing still in place to allow our economy to restart and people to do things that they would love to get out and do things they'd like to do while minimizing our risks.
Yeah, I think that it's an individual thing. I think that right now, if you're following the precautions, you help decrease your risk. But I think, unfortunately, none of us can give you a percentage on what your chances are.
What are some signs that we should look out for? What are those immediate signs now that we should be aware of? From your perspective, what are the main ones that you guys look out for?
You won't feel well. I mean, you'll know when you're feeling your usual self and when you don't feel quite right? So what'll happen in any sort of infectious disease when you're feeling sick is that your energy goes down. You don't feel right. Your body aches. You don't feel like doing the things you could normally do. And then, you might have some of the respiratory symptoms, but you'll know beforehand that you just don't feel well. And that's a good time to have a conversation with us, whether on the phone or on video visit. I would love for you to have a thermometer and blood pressure cuff, et cetera, like I said that. But having said that, I don't want you to get all nervous and hung up about that. Just talk to me. I'd love to see your face, and we'll talk about it, and I'll ask you the questions, what I'm supposed to do anyway. And we'll figure out are you sick or are you well? Because that's the primary thing we want to know anyway. And once we determine that you're sick, are you COVID sick or are you sick from something else? Well, we'll talk it over and see what we can do.
I think in kids, we're looking at fevers. If you have a fever, cough, shortness of breath, if you're working hard to breathe, abdominal pain, diarrhea has also been associated with it. And they are noticing there has been something about the COVID rash, and that typically comes after the illness, or it could be with it. So I think fever, rash, cough, shortness of breath are all reasons to touch base.
And then, Jason, for adults, is shortness of breath still another one of those main symptoms?
There's some specific symptoms like temperature greater than 100.4, shortness of breath, cough, body aches. Yeah, I say that. However, I do know that for my older patients don't reliably get a good fever sometimes. Older patients don't reliably get a good cough because the muscles and their airways and their immune system is just not the same as when you're younger. So sometimes you don't manifest those symptoms. All you know is that's why I was so general about it. Sometimes you just don't feel right. And that's why we had that talk.
And recently, Chris Cuomo, J.K. Rowling, they've had COVID-19 symptoms, and they were advised by health professionals that they should do deep breathing exercises to beat the condition. What is your guys' take on that? Is that treatment effective? Does it help? Have you guys heard anything along the lines of breathing to be able to help build lung capacity or allow the body to get more oxygen? Is that proven effective? Is there any science behind that?
I think that improving ventilation to your lungs is always important. And studies have shown that, if you have good ventilation, you're less likely to get pneumonia and you can recover from pneumonia faster. That's why after surgeries, we give you this little canister device called an incentive spirometer, and we make you do deep breathing exercises after your appendectomy or after your knee replacement, because we want to prevent you from building up fluid in your lungs, which would promote pneumonia development there. Mm-hmm. So deep breathing does help. And having said that, how do you do deep breathing, right? So we always tell folks that it's 1 second in, 2 seconds out, or your exhalation should always be twice what your inhalation is. If you exercise regularly, if you lift weights, you'll know what I'm talking about. When you're bench pressing, for example, as the bar comes down, you'll take a breath in, and as you're pushing out and doing your maximum effort, you will take 2 seconds to breathe out as you're pushing out. How often should you do it? They say that if you do some cardio, 150 minutes, that's the American Heart Association says that per week. That's a good split over 3 times a week. That's a good start to do it. And if you want to do deep breathing, like watching TV, go ahead and do that. Like I said, it's 1 second in, 2 seconds out for about a minute. Don't go over that. Why? Because you'll hyperventilate. You'll get the dizziness, the palpitations, and the headaches.
You see stars.
Yes, you don't want to hyperventilate. Then you'll feel worse.
And I think inherently it makes sense. The deeper breaths you take, the more you open up your airway. And in kids, that's one of the reasons why we don't use a lot of cough suppressants, because we want kids to cough. When you cough, you open up those airways. You take a deeper breath.
Oh, you want kids to cough?
Yes, coughing is actually good for you. There's a reason. I always tell parents there's a reason why our body does the responses it does.
That's interesting. I have never heard that one before.
Now, there's always a balance. If you're coughing all night and getting no rest, obviously, then, there's a balance between those. But in general, I do tell parents our goal is not to suppress the cough completely. So it is good to cough. For kids who have bad colds or when they're younger, there's something to percussion where you just literally, I don't know if this is a video tip, but you just cup your hand and you just pat their back.
Oh, yeah.
If you think about our parents, our previous generation has just patted us on the back on all sides. And there is actually something to that. And cystic fibrosis, actually, they have a whole system to try to help with drainage and things. So I don't think you need to pick a complicated way to do it. Just pat your child's back if they're coughing a little. I think deep breaths, and kids think of it more as meditation. When you meditate, you are focusing on your breathing. You're focusing on taking bigger breaths and blowing it out. And there's a lot of benefits to that. So not just from that COVID-19 for your respiratory lungs, but also for your mental health.
I want to ask you a question about this mysterious illness that's been popping up, and I've gotten a few emails about it. And it's a mysterious illness affecting kids, and that is possibly linked to COVID, but it has symptoms similar to Kawasaki disease. So I wanted to know, have you heard about that? Is it something I need to be afraid of? Do I need to monitor any specific symptoms for my kids? Does it spread? So I'm just interested in your viewpoint on this.
One of the things that people should take faith in this medical community of ours, with DuPage Medical Group and just the general medical community in this time of our internet or our ability to connect with many people, is that these are informations that are coming frequently. Like, we're getting updated on things. So I just had a pediatric meeting last week where we were appraised of it, got some input from local areas and things. So this is a relatively new thing. So Kawasaki has been here for a long time, and we've always been unclear of the etiology. We don't have good answers. Everybody has theories on it, but it is something that unfortunately we can't tell you who's going to get it, who's not. What we do know is it's very rare and it's treatable. It's looking for the signs and symptoms. This new mysterious illness has a lot of similarities to Kawasaki. It hasn't bear fruit completely. Some of the cases have been associated with COVID, some have not. So it is unclear. This is an emerging thing. The numbers are extremely low when you look at this. So would I tell you, should you worry about this? I always think that is a trick question from parents because we will always worry about our children. But I think this is a very low worry. This is not something you can do specifically to go avoid. There's nothing different. What you should do is follow general healthy rules, follow the things that we've been telling you with the COVID. Things to look for. If your child has a prolonged fever for more than 4 to 5 days, they have inflamed eyes, they have lots of vomiting, diarrhea, they're looking very ill. Those are things we want you to get care for. We want you to touch base with us earlier than later. Our biggest fear as pediatricians is that people will not seek care. And I've had to address this a few times with telemedicine, where they'll, see a child and I'll be like, they need to be assessed. You need to go in. And I don't want to take the risk. I don't want to take the risk. And remember, again, COVID-19, especially in children, has been borne out overall that they do well. And what we shouldn't do in all of this illness that we have is forget normal things, like people get appendicitis, people get heart attacks, children get other viral illnesses that may need to be looked at.
COVID is still a very small percentage of the patients that you treat.
Correct. And there's so many things that we can treat and we do well with that we should not ignore those signs. We shouldn't let the fear of that interfere with getting care. And all these precautions are in place to minimize the risk.
Right.
And that is the most important thing. And if you are afraid or concerned, please, if you do not feel that you can come in, reach out by telemedicine. Make sure you reach out.
Let's talk about how we can stay safe, healthy in our homes. Actually, before we get on that discussion, I do want to stick one more time on the mask question, because we talked about masks a little bit earlier. They are mandatory now. We need to wear them, and kids need to wear them when we go outside. Can they do more harm than good? Is there a proper way we should be washing them? Is there any precautions that we should know about mask maintenance and maybe some specific don'ts regarding wearing masks?
Well, I would say this mask, there's so many different kinds. There's N95 masks, there's cloth masks, all the way down to cloth masks. You make at home, some homemade masks and bandanas, everyone's
That's kind of what I use
masks.
Sometimes as a bandana.
In theory, I mean, if I put you in a room wearing any of those masks and I put like a virus in there, would it stop the virus if it was floating around the air? No, it can actually penetrate the mask, actually. So none of those masks actually will stop, because a virus is much smaller than the mask's filtering abilities, actually. So what's the point of having the mask? Well, actually, the mask is there to protect everyone from you, So having everybody wear a mask does two things. One, it prevents your droplets from getting onto the shopping cart or the grocery store aisle or keyboards or whatever. Then, and so therefore, if everyone hangs on to their own droplets, then your risk of transmission is much less. It doesn't get a chance to aerosolize into the air then. And so that's really helpful for everybody else. And the second thing is, let's say you're sick and you don't know it. You think it's allergies, you think it's a minor cold, it's not COVID, or maybe you don't have any symptoms at all, right? It doesn't stigmatize anyone to wear a mask then, because we're all wearing masks. Then nobody's going to avoid you because you look like you're sniffling or you're sneezing or something like that. Especially in allergy season, if everyone wears masks, then nobody's going to feel like somebody else is, should be avoided.
So I agree. I think you do need to wear a mask when you are out in public or if you are going grocery shopping. Again, with children, it is a challenge to keep a mask on. At this time, we recommend if you don't need to take your kids with you, don't take them with you. There really is. Now there are people and individuals that may not be able to leave a child at home, a single mom, and she is unable to get a babysitter or does not have anybody who can watch that child. So you may see a child at a grocery store So I do, but if we can make sure that child is wearing a mask, children touch everything, possibly maybe have them wear gloves. You can make them wear their winter gloves to keep them from touching everything. So that way it can help cut down the risk. So nothing is going to be perfect, but again, we're looking to minimize the spread. I think what's also important to remember, I know I've had to remind my kids, just because you wear a mask does not mean you then don't socially distance. You must still socially distance by 6 feet.
One thing I would say about masks, if you're wearing one, try not to touch your mask. That's the way it's going to get onto your hands, then it gets on there. So, because that mask is the barrier hanging onto all your droplets, right? As far as washing your mask, go ahead and wash your mask until it falls apart, of course. But within reason.
Your nose.
Yes.
Oh, cover your nose. Okay.
Your mask must cover your nose and your mouth to be effective.
Right.
But when you wear it for a while, it's almost like I can't breathe. Like I just can't inhale the same amount of air.
So remember that when you're outside and you're exercising, as long as you're keeping distance, you do not need to wear a mask in that situation. But I do recommend you take the mask with you if you should end up being at a stoplight where everybody's trying to cross the street or something like that. As you talked about, try not to touch your mask. Trust me, all of us healthcare providers have really practiced this skill. Try to use your hands to take your mask off from behind, like with the bands that go behind your ears, instead of doing like this. Or if you do need to adjust it, because I actually had a mask on that was kind of like riding up by my eyes. I'm like, I can't see, to take it by the edges and to pull down, or at top, but not to, like, as Jason said, touch your whole mask in front of you. Now, if you accidentally touch your mask, right, no need to go screaming all over the place, just hand sanitize, wash your hands, right? We just need to remember all the things we've been telling our kids and everybody else for years on end. Wash your hands, wash your hands, wash your hands. Try not to touch your face. Try not to bite on pencils.
Let's go on to this topic of our immune system. That to some point, don't we still want to be touching things outside and still getting, samples of I guess bacteria that's out in the world that would help grow our immune system and keep us healthy. Can you guys talk about the immune system and ways that we can boost it? Because we are in a bubble now and we're not being exposed as much. So what can we do to boost our immune systems while we're at home?
Don't worry. Just because you're wearing a mask doesn't mean you're not exposed to everything. All the mask does is prevent your droplets from getting to everybody else, but you are getting exposed to like every pollen and allergen and bacteria out there still. That's really what it does.
And remember, our mouth has tons of bacteria. Every time you brush your teeth, you're actually making your immune system work, and you're still exposed to everybody in your home and that. So I don't think you need to do anything additional to boost your immune system, but good things to boost your immune system as to exercise. We know that has benefits for your immune system. Good sleep, making sure that you're getting an adequate amount of sleep. So for my teens, for example, I guess the nice thing about all of this is we've always promoted that teenagers always go to bed late and they wake up late. And our high schools were starting so early. We had a lot of kids that were sleep deprived.
They're rested now.
They're rested, but we do need to make sure that they're staying rested properly. So I have scenarios, for example, of children that aren't going to bed till 1 or 2 o'clock in the morning, and then they're waking up for like a Zoom class at 9, and then they're sleeping for 3 hours in the afternoon, and then they're napping throughout the day. And that may not be as good. You may not feel well after doing that. So you need to get that continuous sleep for 8 to 10 hours. So yes, your teen will go to bed later, but maybe not 2 a.m. Maybe it's more like 11.
A lot of my adult patients have problems with insomnia, probably because in their teenage years, they did that sort of stuff, right? So we always emphasize what's called good sleep hygiene. That means you try to go to bed at the same time every night, try to get about 6 to 8 hours of sleep, whatever your body actually wants. And you wake up at around the same time too. So if you establish your body clock so that it's regular, so that if you have that, then you'll find it easier to get to sleep all the time because your body knows it's time to go to sleep, and you'll find it easier to wake up at that point in time as well too. Instead of getting like naps here and there, we want to try to establish a more regular pattern. And then your ritual of getting to sleep is always the same. You're going to turn off your screens. You're going to You might do whatever you're going to do until you get sleepy, like read a bit or watch your TV. But then you turn off the TV, you have a darkened room, you go to the same place, you go to bed at the same time, and you wake up at the same time. Having good sleep hygiene goes a long way towards preventing sleep problems later on.
And for children especially, it's important to cut off those electronics earlier. The general recommendation is 1 hour prior to bedtime, which is very difficult to do.
Very hard to do. Yeah.
It's hard to do as an adult. I mean,
definitely.
It is a struggle, but I think it's worth that struggle. And especially if you have a teenager or a child that is truly having sleep issues and that, and it is something that's worth investing in, because sleep is key to your immune system. And then lastly, just eating healthy, trying to have a well-varied balance in your diet. I always try to encourage children to eat the rainbow on their fruits and vegetables, meaning different colors of vegetables.
Yeah.
Or things. I think when we overcomplicate it.
And then they eat Skittles.
Yes. Yeah. I haven't had a child tell me that yet, but they will. I do tell people it has to look like a fruit or a vegetable. So I think just, and then get outdoors a little bit, get some sunshine, walk around a little. Those are good mental health immunity.
It's funny you say that, because about a month ago, 2 months ago, when this first started, it's like, you want to go for a walk? No, I don't want to go for a walk. You want to go for a walk now? Oh my God, let's go for a walk. Let's go outside. So the boys, they actually love going out because that's their only outside time. And so that's where, we're able to get some fresh air. But it's very important. It does wonders for the mind, does wonders just for clarity and getting some relief, I think, from being indoors.
Oh, I was going to say, I was wondering if all the dogs in America are getting skinnier by all the walks they get to go on now.
Oh, dogs are winning. Dogs are the true winner in all of this, I think, right? Dogs are just like, yes, my owner is home with me now, and I get walks consistently. Let's talk about stress. And a lot of people have been under stress, so much more than usual, especially the last 2 months. How does that manifest in our bodies? What are some things that we can say, you know what, this is a stress thing. This maybe isn't anything deeper than just I'm stressed out and my body is physically now trying to warn me. I need to find more ways to kind of self-soothe or self-cope or manage this.
Stress comes out in a lot of ways. Increased blood pressure, poor sleep, decreased or increased appetite, higher blood sugars, and then a lowered immune system. So it'll all those things can happen. And because it's such the symptoms are so general, it's hard to say that anything's due to stress. I think it contributes to a lot of conditions, morbidity, mortality, like hypertension, your blood sugar and diabetes, your respiratory symptoms and asthma, things like that. Of course, it'll make all of it makes it all worse. In any condition that I'm treating, if I saw you for asthma or diabetes or high blood pressure, we'll have a talk about how stress is affecting your life and how you're coping with stress right now, so that if you can cope with that better, you'll be able to cope with your primary condition better too. Mm-hmm. And ways to do that, as Priti was talking about, getting out there, going for walks, social interaction at a safe distance, getting a hobby. And right now, since you can't go to a restaurant, learning how to cook a healthy meal for yourself is all those are good things.
Mm-hmm. Priti, have you noticed any differences with kids right now? Because they're not at school. They got, a lot of them are still dealing with being at home full time and then dealing with the virtual learning. It's a lot on kids too.
Well, my fifth grader told me I'm an awful teacher. I've been told that twice this week. So I'm going to have a parent-teacher conference. I've decided
it's hard, right? Because you are literally wearing both roles. You're being teacher and then doctor full-time. Oh my gosh.
But I would say it depends on the age of the child, and it really depends on that kid. So there's a lot of variabilities. But in kids, a lot of times what you'll see is you may see insomnia, where they are not sleeping well. Mm-hmm. You might see bad dreams. Common symptoms, especially in younger children, is they'll keep complaining that their tummy hurts or their head hurts. Those are common complaints of stress in younger kids. You will see irritability in teenagers, especially. I sometimes think as an adult I show it that way, but especially in teens, just they're irritable. Teenagers are a little prickly to begin with at times.
It's a good word for it, prickly.
Yeah. There's a great saying that trying to raise teenage boys is like trying to hug cactuses, and you just kind of get a little poked back at it.
we'll come back to this.
Yeah. And kids will show regression in their behavior too. So, something that they used to be doing, they won't do as well. So if you have a toddler, for example, they may have more accidents with peeing. They're spilling more things. They suddenly can't remember how to do something. Older kids may show they show an ability to actually learn something, and they can't vocalize, I miss my friends, or I miss this, or this is hard, So I encourage parents that when we are dealing with our children, sometimes it's just good to take a moment break from it and to realize it's not going to be like this always, that you don't always have to get to the root cause. I'm guilty of also doing this with my children. I'll be like, what's wrong? Tell me what's bothering you. Just spit it out.
I love that you just said that. You don't always have to get to the root cause.
Yes.
I need to know why. I need to know I need to know who hurt you.
Right.
What's going on in your brain?
That's a physician part of me that comes through. I'm supposed to find a solution to everything. And I'm a pediatrician, man. I really should know how your brain ticks, and you just don't know. And I think what we have to remember is they don't know. They actually don't know what's bothering them.
Yeah, they don't. You're right. They absolutely don't know.
No. So as many times as you ask, well, why'd you pee on the floor? They're going to be like, I don't know. And you're like, okay. And you just have to accept they just don't know. And change is hard. And what we encourage is you don't necessarily need to, they're going to hear things. They know something's up. They're very smart about that, So it might be better, if your kid, that they're kind of worried about it, maybe just even asking them, well, what do you know about COVID-19? What are you afraid of about it? Or what are you worried about it? Sometimes I'll be like, oh, and they'll be like, nothing. I'm not worried about anything. And I'll be like, oh, okay. Have your friends been worried about anything? Have they said anything? Because sometimes that's a way to get to questions that are kind of coming
an indirect question.
Yes, to ask them. And I think it's fair to say, mom's frustrated with this. I'm tired with this too. But, we're keeping everybody safe, because sometimes kids will ask, am I safe? And I always tell parents, we must reassure our kids. Yes, you are safe. We are doing all these precautions to make sure, remind kids they're being the superheroes, not just the doctors and the nurses that are heroes. The kids are being heroes. They're being heroes because they're not going to school and they're not getting to play with their friends, and they're wearing a mask, and they're making a difference. They're helping keep our community safe. So empower them that they are making a difference. And they are helping, and as hard as it is.
Yeah, that's a great
job they're doing with it.
Because I don't think I've given any credit to them on that front. You are doing your job. You're making a difference. I've done that for almost every other person or group, but not to my kids. And that's an important distinction that you just made there.
I think we gotta empower them with it. So
I have a few questions from different age groups. I'm going to ask you, Priti.
Okay.
Well, it's from them, so I'll just let you answer it however you want. This is from a 7-year-old. Why does it make some people so much sicker than other people? And they're specifically referring to COVID here. So why does it make some people so much sicker than others? That's from a 7-year-old.
So because every person is made a little bit differently. I flip it and I would say some people can play the piano better than others, no matter how much of two people practice as well. Some are better at it. Some people are better at reading at 7 versus other kids in your class. If you look at your classroom of your friends, each one of you is better at something than somebody else is. Mm-hmm. And certain things in our body put us at more risk for it. So unfortunately, older people, their bodies have worked really hard at their immune system. They've been working for a long, long time. So that virus tends to get them in trouble a little bit more. Think of it like a car. The newer cars run a little faster and a little smoother, where the older cars are a little bumpier. If they're on a bad road, they might get a flat tire a little quicker than us.
Okay. That one's a good one. This is from a 9-year-old. Do you think summer will be canceled because of this?
Summer can't be canceled because it comes every year. Even in Illinois, we get summer. The sun will come out at some point. The weather will get better. I think our summer will look different. I think that it may not be the same type of summers we've had in the past. And we can be sad about that, but there'll be some good things that will come from that summer. We may spend less time running to games. We may get to do different activities with it. I think that some summer camps are going to be canceled. So activities that we used to do, we may need to do them differently. We need to do it by Zoom. But if we keep doing our job, then by staying indoors, doing what we need to, we improve the chances of us being able to do more and more things.
I'm glad you answered that question, because when that was from my son's friend. And I'm like, yeah, summer's canceled. Summer is canceled.
Well, my son is really sad about summer swim, and
Yeah.
I think there's a good chance we're not having summer swim, and we'll see. Our summer swim team is doing a great job of like trying to come up with some activities. But I looked at him and I go, I think this means we're just going to have a lot more water balloon fights and sprinklers going on outside. And
The slip and slide.
Yes.
Have to bust out that old slip and slide again.
And I'm like, if we just do a lot of sit-ups, it will feel like we're doing swim team again because we'll be sore from swimming.
Yeah, there's ways to get the water, and we're going to have the sun, and we'll probably be home and at least enjoy some of that time that we probably might not have enjoyed together if we weren't all home together.
Yeah, and I think it's important to acknowledge that they're feeling sad and to say it's okay to be sad. But here's some other things that we're going to do. It balances it out a little bit. I think when we tell kids, don't be sad, it's not a big deal. It's a big deal to whatever is personal to us is a big deal to us, and I think that's what we just need to remember.
Mm-hmm. And then the final question, this is from an 11-year-old. Why can't I just play with my friends? They've been, inside as well. Why can't I just play with them? They're right here, next door neighbors. Why can't we just play?
Because we also have other viruses. So somebody in that home is going out. And, even though we're trying to be as bubbled as we are, we're not 100% bubbled. And so we do not want to, again, spread something to somebody else. However, you can try to be creative, possibly. I know in our neighborhood, lots of the sidewalk chalk messages are going on. Yesterday, my boys were playing outside. They were keeping their 6-foot distance because usually somebody's out there watching just to make sure. And the kids all had their gloves on while they were doing, and each child had their own basketball, and they were running around the cul-de-sac, checking their basketball skills and timing each other. So they were staying socially distanced, still talking, and being able to communicate. But I think it's really important to tell them that it's hard to understand, but we do need to keep that distance because we are still spreading other germs that we need to be careful of.
Mm-hmm.
We adjust. Yeah. I mean, we play horse. We don't play basketball.
Right. Yes. There's games that you can play or adjustments you can make to make the old games that you played safer and accommodate the rules that we have for safety now while still being able to be outside. And,
and I've told some of my what I've told my kids as well. I'm like, we've gone through this once before, something similar when the 1918 pandemic hit. And I go, and at that time I go, but we managed to get past it, that came forward, and we had less medicines, less technology, less devices,
less information.
And it, and so as awful as this is, there are some positives that are in here as well. And it's important to look at those positives as well.
Mm-hmm. And then the final question I wanted to ask you guys, when I go to the doctor, and as a woman, one of the questions that I always see is, are you okay? Do you feel okay? The intake forms, there's always that question. Do you feel okay? Is your mood okay? Are you being abused at home? And there's kind of those pre-screening questions on what's the household arrangement like? And right now, domestic violence is like spiking, and we're seeing a lot of reports around this with people staying at home. From your guys' perspective, and you're not seeing as many patients initially during the whole fear of people not wanting to go to the doctor at first. What are some ways that people who are at home can stay safe, or if they are in a position where they're maybe more fearful or worried, can they still reach out to your office? What's your recommendation for that?
There are resources for that. And yes, since people are confined to their houses, the big thing is that there's an increase in domestic violence or child abuse, things like that. So from the adult standpoint, domestic violence, things like that, you can certainly reach out to your local police department or fire department, and also us. We do have, it's called Common Ground, and it's a shelter for abused and battered women. And we have those resources, and we have other resources we can give you the numbers of as well. Or you could reach out to them, you can get them directly. As far as like doing a video visit with me about that. If your abuser is at home with you, that could be problematic. So maybe coming to see us or finding, doing a visit from somewhere else would be helpful too. But either way, if there's any concern, let us know, and we can at least, even if we can't help you directly, we can get you set up with the resources to help you, because we do run into those situations once in a rare while out here.
And if you're in immediate distress or in a situation that's acutely unstable, call 911. Get that immediate help. I guess I don't deal directly with domestic abuse. I will occasionally have a mom open up to that. I don't see that happening as much on a televisit, as Jason said, because you're probably at home with your abuser family. And in that situation. So it might be a little bit more difficult. With the children, if we notice anything or see anything that we're suspecting, then we will report that and get that investigated still. It's important to take breathers. I think even the best of families are stressed in these circumstances. You can love your family and still be irritated with them.
Yeah.
I think we've all done that type of thing. So I think it's important to have some breathers, have some maybe I've told parents with their kids, maybe have a funny word as your break word, like I just need a break or coming back to it. Like my fifth grader one the other day told me I wasn't a good teacher. And he was just crying, and I finally looked at him. I go, it just looks like it's a quarantine bad day today, huh? I go, is today your bad day? I go, we can call it a bad day.
Yeah, I'll give you a pass.
Yeah, I go, let's call it a bad day. I go, let's, if you just need to cry for an hour and just be mopey for an hour, we can do that. And then we can figure out something else we're going to do, because sometimes we just let them mope for a while. It's a little bit easier to move on. I think as, I don't know, sometimes, how you just need to whine or vent.
Yeah, you just want someone to understand. Yeah, you don't even want someone to fix it. You just want a voice.
You just want someone to listen. Yeah. When you're in close proximity with somebody for a long period of time, you get bored and snippy. It just happens. So, and we understand that about each other and ourselves. Fine. Eventually it'll get better.
Yeah. My friend last week, she's like, you just got to give people grace where needed. You just got to give people grace where needed.
Yeah. You just have some understanding about that and just say, okay, maybe you're just having a crappy day because you're a little cabin fever,
Well, I appreciate you guys taking time to join this podcast. Those all the questions that I had, and I certainly appreciate you guys for coming on and being guests. Thank you guys.
Well, thank you.
Thank you for having us.
Thanks for having us. Yeah.
Yes. All right, everyone. I hope you guys appreciated some words of wisdom from these local healthcare heroes. And then until that next time, bye guys. Bye everyone.
Bye-bye. Thanks.
Bye. Stay safe.
Thank you for listening to Tuesdays with Andrea. There are hundreds of thousands of podcasts out there, and I appreciate you making the time to listen to mine. If you like this show and want to know more, check out TuesdaysWithAndrea.com, or please leave a review on iTunes or drop a line in the YouTube comments section. Until next time, please stay kind in your mind, nice on the web, and stay hella hopeful in your heart.